Thank you so much, Shaun, for joining us today and talking about your company, Anpac, and the impact you are making. Go ahead and start and explain to us exactly what your goal is.
Yeah, Anpac is an early cancer detection company through blood. So essentially what it is you take 2 cc of your blood, and we're able to test 26 types of cancer in early or disease stage in human body. And the company has established since 2010. Initially, the operation and the testing and the marketplace is in China. So to date, we have roughly about 140,000 cases screened. And the company is generating revenue, of course, in China. The technology itself, it is a novel technology. It's developed by Anpac, and we also developed our own machine. The technology is called cancer differentiation analysis. In short, it's called CDA.
Okay.
So that we developed ourselves. We have over 121 patents issued.
I saw that.
Yeah,
That's impressive.
We have over 200 patents written worldwide. We are entering United States. In fact, we're here for a few years already. We established a laboratory here in San Jose, which is a clear certified lab, and we're developing the laboratory developed test, which will be able to use that certification going to marketplace in North America, essentially testing cancer through blood.
So many questions.
Yeah.
So, how many machines do you have to date?
So far, I would say roughly about 10 to 15 right now. Yeah, we make our own machine. We design our own machine.
Well, yeah, you developed nobody else can make it.
Right, yes, yes.
So you have 15, and they're in how many countries, or where are you focused?
We are mostly,
San Jose.
primarily our up-to-date, the testing and the clinical study, majority of the clinical study and the marketplace are based in China. And then we are going to be doing the same thing in North America.
Well, it's remarkable, it's overdue, and
another great thing about Anpac is that we are cancer detection company, and we're saving lives on daily basis. For example, during the over 100,000 cases that we tested, we screened out roughly about 6,000 to 7,000 high-risk patients through general audience, and among them, there are 600 to 700 of them tested positive, and those people they're themselves and their family, and they come to thank us with tears in their eyes. We just really saved their life.
It's got to be tough.
Yeah.
That's a tough.
Well, it's early. You caught it early,
yes.
and you saved their life.
But that's still a tough message to deliver.
Well, if you don't caught that early, what's the consequence?
No, you're absolutely right, but it still doesn't make it easy, probably.
Yeah. But they are thankful because once you catch it early, there are different ways of treatment.
Absolutely.
And much more available, and also the cost of the treatment is significantly lower, and the life save rate is so much higher than if you caught it.
If you caught it early.
Right.
We run into that with like mesothelioma, and there's so many different cancers, and so yes, I can't even begin to agree with you more.
Yes.
Have you ran into problems with the FDA or certain American regulations and compliance issues that have been a roadblock?
Yeah,
I'd love to hear about this, because there should be no roadblocks for this.
Well, not necessarily. It depends on how you proceed. In China, we have large database. So in fact, we are probably the largest database in this space in the world. And then in United States, of course, we have to validate that. We have to do the clinical study, which we are doing very actively right now. We are actually signing with multiple different organizations, universities, and hospitals to design different studies and doing different clinical studies. Now, as of United States, it's, as we all know, this is the most heavily regulated industry in the world. United States probably is one of the hardest. And we fully understand and we respect that. And we want to bring that technology to the United States, helping saving lives. So by saying that, FDA, we will definitely go. In terms of commercialization, we have a plan of develop, like I said earlier, into a laboratory developed test, which you also have approval process. Once you get that done, you are actually, it's a test.
So when they take the drop of blood, they send it
It's
to
not
your
drop,
lab?
2 cc. Yeah.
Oh, 2 cc. Okay,
Yeah.
I'm sorry.
Yeah,
2 cc.
yeah. You send it to our lab,
Okay.
and in about a week or so, you can get a report. The report is going to tell you you are low, medium, or high risk.
Okay.
And in the United States, we plan to roll out some kind of 6 different type of cancer, which is most common in the States. And then to further test, we're going to tell you approximately where it might be in your body. Let's say if you're low risk, you're fine. You are very healthy, no problem, because we can see signals that a lot of people can't see through our technology. So if you're medium risk, that means, okay, you're generally okay, just be careful. Your life habits and your living style, could be the things you eat, could be the whatever the time schedule you have, take care of yourself,
Yeah.
treat yourself well. And then if you're high risk, and then we can tell you approximately in the 6 types of cancer we might be in your body, where it might be. And then we're going to tell you, go test it.
Yes.
Go to the hospital, get checked in whatever the process
Yes.
that you have.
Put yourself on a program so
That's
you're
right.
always checking in.
Exactly.
Which 6?
That's it. Huh?
Which 6 cancers?
So it's still in the planning, but obviously we're going to be possibly colon cancer and breast cancer, lung cancer, and ovarian cancer possible. And we're still in determination. We're going to find the 6 most
Sure.
common type. Yeah.
Well, you hit a lot of close to home places here, I'll tell you that.
That's
so
right.
I welcome you to the market.
Thank you.
Yes.
Yes.
Where do I give my 2 cc's and send it into your lab?
Yeah, you will. You will. Eventually, you will see it. Hopefully, we are going to market it through independent insured companies and organizations, insurance companies, and so forth. It will not be a daily testing that you can get through your personal doctor yet,
Right.
but you will be able to find us, and you will be able to actually request a test. Wherever you are.
So you need to get
once you hear
outreach,
it,
because if people don't know this test exists.
that's right. Yeah.
then-
So first we do this step by step. We have our clinical study, we have our validation, and we get our laboratory development test certificate through Clear Lab certification in the United States. And once that process is all done, we're going to roll out the product. Yeah.
Well, I think this is tremendous. I love it, and thank you.
Thank you.
Yes.
All
Is
right.
there anything else that I did not ask you that you want to mention?
No, actually,
Perhaps.
How much will the
essentially, test cost?
That's a good question. I was just going to go there. It's a big question, actually.
Sorry, it took me a minute. We can
Yeah.
edit all this, so no
Okay,
worry
yeah,
about it.
that's okay.
Yeah, that's going to be a big question.
Currently on the marketplace.
Do I have to go to China and get tested?
No, currently in the marketplace. Let's say you want to test cancer. You normally go through a genomic-based technology test, ctDNA,
Right.
and so forth. The cost I would see somewhere several $1,000s. Let's say to have a test to see where you are. That's one thing. And the second thing is the sensitivity, the precision of that result. It's not that sensitive.
So
Okay.
you, right, you do need to get in with the insurance
Right.
company so they can cover
And
some
so
of that cost and
whatever
make it more
it is.
available to the
That's right.
market.
Yeah,
Okay.
so that's one thing.
Yeah.
And for us, for Anpac CDA test, we have, first of all, the cost is a fraction of what genomic test. We're looking at somewhere between $200 to $300 per test.
That's reasonable.
Yeah,
If you
right.
consider the whole scope of everything,
Yeah,
absolutely.
and also that's a price point a lot of people would just pay by themselves.
Absolutely.
They don't have to go through insurance. You don't have to go through this. If I have some high risk in my family or in my background or whatever it is, my doctor says, you have a choice. You can do that. So that is, that's the big advantage.
It is a huge advantage.
That's right.
And,
Yeah.
well, remarkable.
Yeah.
And I'm excited.
All right.
Thank you so much for
Sure.
joining us and taking time to sit down and address all these questions.
Yeah. It's a pleasure.
It's a pleasure.
Thank you.
Thank you.
All right.